Thank you very much for the opportunity of telling you all about a project that we're running in Australia, which is funded by the Australian Government, Department of Health, and is in response to Australia's National Strategic Action Plan for Rare Disease. And the project's called RArEST, for Rare Disease Awareness, Education, Support and Training. And it covers the whole of Australia. It's a national program for 3 years. But first of all, I'd like to acknowledge that I'm presenting today on the lands of the Gadigal people of the Eora Nation. And I'd like to pay my respects to the past, present and future traditional custodians and elders of this nation, and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait Islander peoples. So Australia launched its National Strategic Action Plan for Rare Disease in 2020. And there were 3 main pillars: awareness and education, care and support, and research and data. RArEST tries to respond to some of the main action points from the action plan. So firstly, that we recognize that workforce and systems need to respond to the current and future needs of those living with rare disease, that increased awareness and education is a vital first step. So this is important to empower people living with rare diseases to become active participants in their rare disease journey. And that improved awareness is anticipated to have many flow-on effects, in particular reducing isolation, which is often such a core feature of rare diseases, and delays in diagnosis and treatment. And also recognizing what an amazing job rare disease organizations do in raising awareness and providing person-centered information, but that they are often under-resourced. Mm-hmm. So we have a team of both researchers, but also clinicians, evaluation experts, clinical education experts who are part of the team from across Australia, from different universities, but also very importantly, the team includes the umbrella group for rare diseases in Australia, Rare Voices Australia. So it's actually a partnership between this advocacy organisation and universities and clinicians. It's divided into 3 streams. The first stream's focus is trying to improve awareness and resources about the mental health and well-being of people living with rare disease. And when I say people living with rare disease, that's not just people that are affected by a rare disease, but also their carers, their families. And that stream is being led by Rare Voices Australia, and will focus on finding the best quality resources to help support rare disease organisations understand when people in their communities may be developing mental health and wellbeing concerns, but also digital resources to help support people to minimise the risk of mental health conditions in people living with rare disease. The second stream is about upskilling clinicians, so healthcare workers across Australia, and really doing that in a way that is a partnership with the clinicians. So understanding what their learning needs are and then responding to those in a range of different ways. We'll have some national guidelines that will come about from the project, which will highlight what are the key steps and issues that need to be covered in rare disease care. And we'll have a blended platform of an e-learning platform that will be available long-term, which is an adaptation of the Rare Disease 101 platform that Medics for Rare Disease developed in the UK. But also we will set up, in collaboration with Project ECHO, a community of learning practice called Rare Project ECHO. And the third stream is about capacity building in the rare disease sector. And that will be designing a range of advocacy and multi-stakeholder co-design courses, masterclasses, education, and mentoring. This is a quote that our RArEST program manager highlighted for me, which I think is beautiful. When in doubt, ask the experts, those with lived experience and those whose voices have not been heard. So across all 3 streams, we have consumer and multi-stakeholder engagement so that everything we do is informed and developed in partnership with people living with rare disease. And also that everything we do is rigorously evaluated, because this is a pilot and we want to be able to show at the end of it what's worked, where we think that the future direction should be. And hopefully that will be lessons that will be useful for the whole global community with rare disease. So stream 1, as I mentioned, is really focusing on, first of all, looking to see what resources are already out there to support the mental health and well-being of people living with rare disease. And then where there are gaps identified, co-developing resources to fill those gaps, particularly digital resources to help when a person is living with a rare disease, that they don't feel that the possibility of mental health impacts is a stigma, but instead to break that down and let them know that looking after themselves is actually a really important thing and should be first and center, and something that we can help enable. Stream 2, as I mentioned, is really focused on trying to help doctors not feel overwhelmed that there are 7,000 rare diseases. How can they know about every one of them? But more some approaches to good rare disease practice and signposting excellent resources as well. So as I mentioned, we're partnering with Medics for Rare Disease, which has led a very successful e-learning platform for clinicians in the UK, and adapting that to be specific to the Australian context. And we're also very excited to be setting up a rare disease project, ECHO, and this is a clinical community of learning practice. And the idea is that we're bringing in doctors and healthcare professionals from around Australia to talk together, to share challenges that they're finding in providing excellent care to people living with rare disease, and together come up with answers and solutions that are sustainable. And the third stream is really about whole of system change. So how can we think about what needs to be changed at a policy level, and also how can we help support those vital rare disease organizations to do the amazing work that they do in the most effective manner. An amazing slide that Lauren put together, who's our evaluation officer, but just to really emphasize that everything we do, we want to be evidence-based and coming out with some learning points that we can share with the global community. So that's it in a summary. It's really trying to build awareness, education, with particular focuses on mental health and well-being and clinician education. And I'd welcome any questions that people may have. There's my contact details and that of Nada, our amazing program manager.